Welcome to your Daily Health Minute. Hi, I'm Dr. Laura Regan with your latest health news. In mental health news, sleep-disordered breathing may be a risk factor for cognitive decline. A review of data concerning 19,940 older adults indicates that seniors with sleep-disordered breathing are 2.44 times more likely to develop a mild cognitive decline than those without sleeping problems. Today's health alert: patients with borderline personality disorders have increased stroke risk. The National Institute of Health reports that about 1.6% of the adult population in the United States suffers from borderline personality disorder, or BPD, a condition characterized by unstable personal relationships, highly impulsive behaviors, and inappropriate or extreme emotional reactions. A new study involving 5,969 BPD patients and 23,876 age-matched controls indicates that BPD patients may have a 4.82 times greater risk for stroke. The authors of the study conclude patients with BPD had an elevated vulnerability to subsequent stroke and ischemic stroke compared to those without BPD. Further studies would be required to investigate the underlying mechanisms. In diet news, dark chocolate and olive oil are good for the heart. Polyphenols are micronutrients with antioxidant properties found abundantly in whole foods such as fruits, vegetables, red wine, and cocoa. According to a new study, participants who consumed a small daily portion of dark chocolate with added natural polyphenols from extra virgin olive oil experienced both an increase in their high-density lipoproteins, or good cholesterol levels, and a decrease in their blood pressure. In exercise news, reduce your sitting time to become healthier. Study participants who received counseling on how to reduce sedentary activity managed to minimize the time they spent sitting down by 21 minutes each day, while also engaging in more light-intensity physical activity. These participants also achieved improvements in their fasting blood sugar, reducing their risk for a number of serious health problems, including cardiovascular disease. In chiropractic news, seats are important for truck drivers. Occupational exposure to whole body vibration has been linked to an increase for musculoskeletal complaints like low back pain. In this study, researchers monitored the attentiveness and comfort of commercial truck drivers while they use normal seats and newer active seats designed to reduce whole body vibration exposure. They found that the active seats reduced whole body vibration by over 33% compared with the current industry standards seats. Additionally, the drivers reported the ride was more comfortable in the active seats, and they were better able to maintain their attentiveness during the experiment. In wellness news, breastfeeding may reduce risk of endometriosis diagnosis. Endometriosis is a chronic, incurable, and often debilitating gynecological disorder that can affect women. A new study followed over 72,000 women for more than 20 years has linked breastfeeding to a lower risk of being diagnosed with the disease. More specifically, researchers found an 8% reduced risk of endometriosis for every 3 additional months of breastfeeding for a child. Furthermore, women who breastfed exclusively for 18 months or more over their reproductive lifetime had a nearly 30% reduced risk of being diagnosed with the condition. Study author Dr. Leslie Farland explains, given the chronic nature of endometriosis and that very few modifiable risk factors are currently known, breastfeeding may be important modifiable behavior to reduce the risk of endometriosis among women after pregnancy. Today's quote from Eckhart Tolle: "Realize deeply that the present moment is all you will ever have." For more information on back pain, neck pain, headaches, carpal tunnel syndrome, joint pain, and whiplash, go to www.drlaurareganblog.com. This has been your Daily Health Minute. Thanks for tuning in.